It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Welcome to the Startup Health Festival. Here with two of my favorite people, Bob Kocher and Thomas Goetz. Bob Kocher is a partner at Venrock, also one of the most active venture capitalists today in health tech, and used to be special advisor to President Obama and helped create health reform. So thank you very much for that.
Thank you.
Thomas Goetz, another wonderful soul, now an entrepreneur, which we're very excited about, with a very cool new company called Iodine. Also former editor at Wired magazine and author of a couple of books, Love the Decision Tree. Thank you guys both for being here. I know we got a great discussion about some of the 2016 predictions, and also maybe how we balance moonshots with pragmatism. But before we jump into that, quick little story. You guys were both actually part of the genesis of Startup Health. Thomas, you were there at, I think, our launch event.
Datapalooza 2.
Datapalooza 2, and I guess you both were there.
Yeah.
So you guys have really been a part of the entire movement from the beginning. So just wanted to thank you guys for being there with us along the journey. So turn it over to you.
Yeah, that's awesome. Thank you. So Bob, as Unity touched on, Bob has worn a lot of hats in healthcare, and the role of an investor, it's only been 5 years that you've been doing it officially. So I think the best way to think about Bob kind of holistically is whenever there is a conversation, I've been in many conversations where somebody's trying to figure something out in healthcare, connect a entrepreneurial vision to the realities of the marketplace, as well as the kind of opportunities of the changing healthcare ecosystem driven by the ACA and all of those new incentives. Whenever those conversations come up, and I'm sure they've come up many times for all of you, it's always, well, you got to talk to Bob Kocher. As if there's one guy. There's a few of them, but you are probably top of the list of people who seem to understand and have a grasp of all those things at once. I think that's one of the fun things about the time that we have here, this 27 minutes to talk about. And Unity mentioned this, one of the, you as a kind of a prolific investor, which is not a way you like to be described, I'm sure, because when we first met 5 years ago, you kept your powder dry for a long time, and you were just saying it was 18 months before you first made an investment. I want to maybe start there. What changed between that time, when you were kind of just getting a survey of the landscape and not doing anything, to now, when you guys have made quite a few adroit investments of late?
Well, first, thank you for coming. And what's changed is the fact that people will sit on the floor at JP Morgan to talk about healthcare IT and services. None of you are like making new cancer drugs that I know of, or really expensive personal, orphan disease stuff. You actually want to make healthcare work better by changing how we do it. And that's what's changed, is that the market has changed. I mean, we now have the imagination to bring really great healthcare to like 99% of people who get healthcare, not just people like me, who are doctors who know the people who run hospitals. And we've changed incentives, and we now all have phones that work. And so we're at a time where there's product market fit for a bunch of things that there may not have been, I think, earlier, is the first answer to that question. The second thing is, I think we're beginning to see receptivity on the part of everybody who needs to have it to adopt. So there's no health insurance company in America today that says, yeah, we've nailed the customer experience and member journey. There's no provider that could possibly say that they have like reliable execution faithfully of high quality healthcare all the time. There's no doctor who's sort of happily saying, well, fee for service, that's going to be great for the next decade. Employers are realizing that they're getting screwed the most because they pay the highest prices and their workers get the same uneven healthcare that we all get. And so they're getting, nothing. And then there's a whole bunch of engaged consumers who actually are scared enough that they want to get engaged in their healthcare. And so it's a good time to do it, is the first answer. And that time's getting better. In the last 5 years, there's been 500 new startups by our count of Series A companies, and $10 billion of new money that's flown in. And I can't imagine that in the next 5 years there's not 2,000 new companies and 20 billion. I mean, it's too big a sector to let it not change faster. So that's sort of why.
How would you describe your investment strategy?
By not having one would be the answer to the question. People ask me all the time, like, what themes are you interested in? Like, what's your thesis? Like, I don't have it. Like, making healthcare suck less is like my thesis. And that's actually it. It's like, I'm looking for people that are like mutated in ways to make them extraordinarily awesome at doing something, who want to apply that awesomeness to healthcare in an area that we mutually think could be interesting. Like, that's like our investments are kind of all over the place, but they all have like a CEO who's crazy in some hopefully delightful way.
Well, I also think it's deeply pragmatic, though. I mean,
Well, yeah.
it seems always like really very thoroughly thought out, and like somebody better have done their math before they go in and meet with Venrock.
Please do math.
I think that was the first. I mean, when we had conversations when we were
Yeah.
pre-seed, you were like, do the math, which we did to the extent that we could. It was, I mean, there's a lot of hand waving, but there is math to be done. But my question then is, so how do you balance that kind of pragmatic, quantitative approach that's deeply rooted in the realities of the healthcare system, that doesn't assume there's going to be a kind of better version of healthcare to come along, but that that the status quo will remain in many ways the status quo? How do you balance that with the demands of 10x returns on investment? Moonshots, if you will.
So before I took my job at Venrock, I was having lunch with Todd Park at the American Indian Museum, trying to figure out what I should do next when I was leaving government. And among the things he said is go to venture capital, which seemed as plausible as being an astronaut, which is like a moonshot. I'm like, I literally said back to Todd, I'm like, I kind of want to be an astronaut. You think I can go to NASA? He laughed. He's like, well, maybe. But they'd launch me somewhere. And he said, no, go to venture capital. And I'm like, well, I don't know what that is. I've never started a company, been an entrepreneur. I'm from government and McKinsey. Like, that's kind of the opposite of creative destruction. He said, well, a lot of things, and he waved his hands and jumped up and down like Todd can do. He said, well, basically, you just need smarter people to think about a problem, because in a company, there's like 10,000 decisions made a year, and maybe 100 of them matter. You just have to pray to God that those people make those 100 decisions better than the other people competing against them. And if you just do that, it's all going to be fine. And like everything Todd says, it proves to be righter than you think. And so I spend most of my time trying to figure out, is that team, because I as the investor and board member, and as super engaged as I am, like probably in there for like 5 of the 100 decisions. I mean, just they happen without. And so you want to make sure that you have people that are going to iterate faster, and make those decisions just a little bit better is like the main thing that I worry about. But there's no area of healthcare where I wouldn't make an investment, but it's all about the people doing the thinking that makes you want to do it. Because there's nothing that works well, is my ingoing premise. My next ingoing premise is that everybody in healthcare wants to maintain their income and their jobs. So how do I like work around that constraint? Third problem, I believe, is that healthcare costs too much. We can't possibly spend more at the rate we've been spending it. So the central problem is cost. So how can I capture productivity and efficiency? And then overcome the fact that value creation is somebody's income. So how do I work around the fact that, like, if I save money, it's the hospital's revenue or the payers, or somebody's money. So how do I not let that break it? And then if I can get through those, then like we usually have a good idea. But that's the approach. But I was told that I get to interview you too. So I'm going to now flip the tables for a second. So Thomas Goetz is a badass. I met him like, I don't know, 8 or 9 years ago, where he was like the world's expert on personalized medicine, genomic-y things. And he'd written The Decision Tree, which is awesome. But then he wrote another book called The Remedy, which is better. You should read that one.
Which has nothing to do with,
I know,
it's
but
like
so
19th
much-
century medicine, so.
You learn a lot from the history. And he was like editor at Wired, like writing like really good stuff and smart. And doing really well, like he's successful. And he quit his like really respectable day job that like my parents wish I had to go start a company. Why did you do that?
Well, okay, but I think it.
You can ask me questions, but I get to ask you questions.
Okay, I'll answer this because I think the answer is because I saw the same opportunity you did, but I particularly saw it from the consumer point of view. So I saw a profound absence of all this change that was happening that we were seeing, and that has really become quite powerful. Very little of it has been focused on the consumer experience. Sometimes it's focused on the patient experience, which is a different thing. But like people experience healthcare in their real lives. I think I read someplace 99% of people's decisions are made in the absence of healthcare infrastructure. So thinking about those decisions and building the tools and resources that help optimize them was what to me was a huge opportunity and something that wasn't happening fast enough. So that was end of 2013. So that was what we did, and then I was lucky to have a co-founder in Matt Mohibi who actually has built stuff, including Flu Trends at Google. So we're actually building this kind of data platform for better decision making. But that is very much a consumer first orientation, and the idea then is to monetize it with people who recognize what we've built. Now this violates one of your commandments. One of your commandments for the realities of healthcare. So our whole approach, the whole catalyst for me to forsake that wonderful, glorious career, according to you, is woefully misguided. What am I violating? I'm violating commandment 2.
Yeah, that's a big commandment.
Yeah. Sickness does not equal engagement.
Yeah, I'm sorry you're
I don't want to
violating my
critique.
commandment.
I'm not asking for a critique of my company. What I'm asking for, not publicly at least, what I'm asking for more is like how do we get, let me turn this into a question for you. How do we get to the end user, which is people, if the whole gambit of healthcare entrepreneurship is all about the payers, focusing on the payers, focusing on the people who are maybe delivering care, but probably on the people who are paying for it. So if that pragmatism drives you there, the bank shots until you get to the actual patient is a horrible, it almost guarantees a horrible consumer experience, as we have. So riddle me that.
Okay. First, I'm glad that you read the commandments. If you understand them, you can live better. At the end of the day, like, if you're going to make healthcare better, there's somebody who has a healthcare need who will have to do something different than they would have done without you. I mean, it's not that complicated. Like, if you smoke, you should stop. How do I motivate you to do that? If you have cancer, I should get you the right treatment plan with the right provider and a system that's not going to suck. But it's fundamentally changing some action or behavior or choice that was made to make value. And everything else is kind of like around the edges. But it's like each of you need to do something different if you're going to change your healthcare outcome. And most people attacking it are doing it either in a way that's too narrow or not useful enough to get you to get over the inertia of doing Words with Friends and Candy Crush and watching Netflix and using the Starbucks app to buy more lattes. And healthcare competes for your mind share with everything else. And the rest of the world has done a great job at engaging you. And so if you're a healthcare company, you're competing against that. And so you have to be just as good and just as useful. And I feel like most of the healthcare things I need are too episodic, so you'll never remember to use it even if they're awesome, or they're not useful enough. Like, it's not a problem that's like the most important, like above number 22 on your list. And so that's the hard part, is how do you create something useful enough, better than Netflix, so that you'll like want to spend time with it? And that's sort of been the challenge. Engagement for all healthcare companies that I've ever seen, including the ones I invest in, is like a never-ending problem of how do you get people to remember. Like, you can have a great application, but if you're not sick, you don't use it very much. And when you do get sick, you're like, oh crap, I'll just go to the Minute Clinic. I'll do it whatever the old way. That's what I struggle with a lot.
And so you think that's an entrenched part of the system?
No, I think we haven't been imaginative enough. I completely believe we'll have great, big, awesome consumer companies, but they're going to be more useful than the ones we've so far imagined. They have to be.
So you're very big on telehealth and telemedicine.
Yeah.
So explain that proposition.
Because it sucks to go to the doctor. Like I'm a doctor. Like, shoot, I don't wait as long as you do. Believe me, when I show up, like, they're nicer to me than you, and it's still horrible. Like, you go and it takes a half a day. You park. Like, there's no good place to get a latte. They are always late. They know they're late, but they don't tell you before you show up. And then you get there, and the nurse asks you, and then they ask you all the same questions again, and then they type the whole time with their back to you, and then you have to go wait in line at the CVS. It's horrible. Like it's horrible. And then they charge you $185 for that, which is more than I will pay for dinner this month for sure anywhere with my family. And when I go out to dinner, like, they thank me. I mean, like, it's like the worst. It's the worst $185 I'll spend this month. I mean, I could buy a pair of jeans. I mean, it'd be awesome, or maybe more than one. Like, that's just horrendous. With a phone and a camera, you can actually do a doctor visit for like a third of the doctor visits you can do that way. And I, as a doctor, can look at your eyes and your rashes, and I can see your throat, and I can have you push on your knee. Like you can do most everything by phone, and even more if we connected the devices and all that stuff. And it's $40. So it's not, this is math that like you all can do. $185, $40, 3-minute waiting time, 3 hours of your day. plus $20 of parking. Like, it's easy. Of course you're going to do it that way. And employers are beginning to realize that that's cheaper and better. And I think that will be how most of us in 5 years, every one of you in this room, will multiple times a year access your healthcare system via video on your phone. That's a prediction I will make. I'm going to bet you that's going to be true, and that will be way better. The problem with that is that you're all healthy. So none of you right now probably need to talk to a doctor in video this second. So the hard part's going to be habituating you to remember to do it when you feel sick and have a fever and just want help, and that's the hard part.
So I don't think we're at that much disagreement.
I'm sure
at Iodine, we will hopefully, but at Iodine we have this phrase where what we specifically do is try to capture people's experience around medications, because with drugs there is something that we call suckitude. There is intrinsic into the experience of taking drugs. It's going to suck. It is built into the mechanism of taking these chemicals in your body. So what we try to do is actually to get people to volunteer the volume of suckitude in various drugs. And out of that, we've created our data set. So that's kind of a way of using leveraging how horrible the experience is to create something valuable. That's the proposition, what we're doing.
It's funny, I always talk to entrepreneurs and say, well, how can we just suck less today?
Yeah.
Because I don't worry and spend much time imagining the magical health system on the hill, and the end-to-end perfection. I try to figure out how do we make it, back to pragmatism, how can I suck less than the current system? A little bit more every day, because that actually allows you to iterate much faster, I think, to something good than overthinking it. There's a lot of overthinking in healthcare, everything, whenever doctors problem solve, we think too much as opposed to try.
So what about, let me ask you about the, because this helps me touch on another thing that was one of your commandments, which is population and big data are just buzzwords. And I think one of the problems for entrepreneurs is we see these trends and opportunities happen in other industries. And a kind of good model is to extrapolate and say, okay, how can we bring those to healthcare? Because healthcare is the last to do anything. So when something like population health or big data comes to all these other industries and helps make more efficient choices and more efficient management, it is natural to assume that those same techniques will apply in their own way in healthcare. And yet, your premise is that the particular vagaries of healthcare will make that gum up and not be effective. Something like that, right?
Yeah, basically. So I'm not as excited maybe as many of you on the notion of big data and AI and machine learning and pop health, and because to me those are all buzzwords that mean not much. Applying, when Walmart applies to their procurement system, predictive analytics to know how much toothpaste to buy, they're doing it in we can debate if it's 5 or 6 sigma system. And so they're tiny 10 basis points improvements can be really, really valuable. And it works pretty well. Amazon, when they're trying it, since they can do it at such scale with systems that are so reliable, 10 minutes of robot time in the factory can make sense at scale. So for more mature sectors which have highly reliable processes with good standardized data, these things can help. Healthcare operates at somewhere around 1 sigma. So 20% of patients are remitted to a hospital. That's 1 sigma. We kill perhaps 400,000 patients a year, give or take, from medical errors. Every patient that's treated by any health system is done differently each time, no matter how similar the conditions are. We're not standardized to the point where I believe that big data, AI, second generation analytics get you much value, because we can get it all in the first order. We're in the 1 sigma part, where we're trying to get basic labor productivity, basic reliability and fidelity across processes, the right medication, let alone dose optimization schedule to a patient. So I just don't think that the supply sides are ready for the tools. And so I think product market fit will be tougher to achieve than perhaps others might in these areas. The other issue is that business intelligence tools to people that don't have people that use BI tools are hard to sell. So most health systems are actually a doctor, a nurse, and then if they're modern, maybe a care coordinator and a pharmacist and an EHR. But there's no MBA manager person who has a bunch of performance management goals and a CFO hitting them over the head to hit some target. And so you give tools to people that don't use tools. In medical school, we're not taught how to use Excel, let alone business intelligence tools. And so you don't have a user is a problem. And so in other countries, I was talking on the way over here with some investors from Asia, there's a whole level of management engineers in their health systems that are doing process optimization. We don't have that here. And so I don't know who's going to use the tools is the other issue. And then the last problem is that we have changed reimbursement gradually, but that's a gradual process. And 90% or so of the spending still in fee-for-service, which sort of rewards inefficiency. And so there's not as, and health systems are of mixed minds because trading off revenue today to be better positioned sometime in the future is a hard trade-off. And so I've been more circumspect on it.
So, well, then how do we leverage, it goes back to the question. If that is the reality, how do we leverage the creative destruction that has happened in all these other industries, and not just having kind of incrementalism and niche markets? That's great, yeah. But we don't want to be a bunch of vendors. Nobody wakes up in the morning and says, I'm going to be the best vendor in the world today.
Most favored vendor, yeah. I think you need to build the solution. So I don't mind, I love data. Data's like in every company, but I think you need to be solution. So you need to go to them and say, hey, we do something, you don't have people who do it. Like, let me take over a function for you. Let me, outsource it to me potentially, but build the full stack is my basic premise. And so in the companies we've invested in, that's been the model, is like, well, let us do it for you. And that thing will, here's why the value prop would work, and here's the economics and how it works. But the service layer is really important. I think tech-enabled service is sort of what I get excited about as opposed to the tech. Yeah. Because tech without somebody to use it effectively to create value back means they won't pay much for that, and they'll pay a lot more for a service usually.
One more question. Okay, so what is one thing you've been wrong about since you came here?
Dude, so many. I get to ask you one more question though before we go, because I have three and I only asked one. I think I've been wrong about, I'm wrong every day on things, and so I'm constantly learning and feel blessed to have a job where I get to do that. I've been surprised at how accepting everybody is of health hospitals in particular that don't adopt modern approaches, and how accepting employers have been to let their employees keep going to places that continue to harm patients without plans to solve that. I've been surprised at how capable payers have been at continuing to not fix the member experience. They've consolidated instead of fixing themselves, which is sort of confusing to me. I've been surprised that every doctor's not sort of in risk because they can do so much better in risk. Like, there's still a fair amount of testing the water. I think that the water's sort of clear. You can do better in that. I've been surprised at consumer engagement. It's been slower back to my commandment than I would have predicted 5 years ago, maybe. I don't know. Everything surprises me. Surprised by, today, there's yet another company announced that's going to do liquid cancer. It's surprising. So, all right, my question to you. What surprised you most now that you're a CEO? What's weird about that?
I think, so this is the last question. So yeah. I think
I could go
not
on.
to give me the last word, but I think the interesting thing for me has been how many assumptions that you have internal, even having done the math, you're going to be wrong. So building in time as a startup and as a team to not just build what you think is going to be the best solution, but building in time, anticipating that is not going to work. People aren't going to respond the way you think they will. And so you will need to do something else. And you will hopefully be able to leverage what you've learned based on the failure to improve upon the process. But that as part of the cycle, like there has been no launch or feature or strategy that we've tried that has just purely, well, maybe a couple, but that have been pure home runs. And actually now building into our process the fixes along the way has been essential. So
thank you so much for listening to us and engaging. Thank you, Tom.
Thank you, guys.
Thank you. Thank you, guys.